All right, so we have our numbers from yesterday evening, and you can see the state of Georgia is kind of lit up here. We when we're including both the antigen and the PCR cases for the county, we are at 356 cases per 100,000. You can see that over the since the surge, just when you put it all in perspective over to the right, you can see just how massive that surge was during the holidays. And we really hope that we do not get anywhere close to this again. It makes our July 4th surge look minuscule compared to what happened to us over the holidays. So it really sometimes takes time and perspective to be able to see these things. One of the things that we did hear this yesterday and today is that there has been a lag in electronic reporting from some of our community partners, and so and it's kind of throughout the metro, it seems like, and so we may see a data dump soon. I think we will see in the next few days, and so that may shift a little bit. And it's probably going to shift upwards. So I just want to make sure everybody's prepared for that, there will be a data surge that will come through. What is really important, though, is that even at 356 cases per 100,000, it is still extremely high. And so we are between 3 and 4 times what is considered high transmission for this virus. So we have a little bit of breathing room, but it's not time to let down our guard quite yet. We see the number of deaths as well. When we add the confirmed number of deaths with the presumptive, which is antigen and the PCR, we have actually 941 deaths to our district. You can see over on the right the time frame over which these deaths came in, and just the sheer numbers that we had. It was a very deadly surge for our community, and we definitely have to keep fighting to prevent anything more from happening. You can see that our cases are over 70,000, and we look at that PCR rate, and I put the little asterisks there because we are seeing an EHR delay, and so that will come in and probably increase those numbers. We are seeing some improvement in hospital admissions, but the acuity is actually still quite high, so people are very sick when they are being admitted to the hospital. I wanted to talk a little bit about the variants. Now, you're going to hear me say every now and then that this battle that we're waging right now is a battle of time, of whether we can get as many vaccines into arms as possible and beat the number of variants that are coming through. So I've presented to you all before that the doubling time of the variants, especially the B117 variant, is thought to be every 10 days. And I remember when we had our first cases here, and we're at 171 for the state, and that is a huge undercount. They test very, very small numbers for the variant. And this week, we were announced that the South African variant is also in the state as well. And so there are 3 recorded cases of the South African variant, and that one also can spread very quickly. And so remembering that we have this battle against these variants as well as we continue against COVID-19. So we have to make sure that we keep them at bay as we get people vaccinated. So it has to be a combination of prevention as well as vaccination. When you look at Georgia's counts, we have over 2.3 million doses that have been administered already. In Cobb County, we have 143,000 doses that have been administered. This is not the number of residents in the county that have been vaccinated. It's actually just how many have been administered in the county. And we are seeing that our residents are able to get vaccines throughout the metro area. We've done over 32,000 for a CDPH, and probably closer to over 33,000 at this point. And Cobb only has done, I know, over 28,000. We still have a couple of numbers that are coming in from the weekend as well. So we heard news of the Janssen Vaccine that's come out, and so this is through the Johnson & Johnson company, and so we have a single vaccine that is being administered throughout the state. The state has gone ahead and prioritized educators for this vaccine, and I know that we have received some in the district for that use. And so it is a convenient vaccine with 1 dose that is administered for those over 18 years old. When you looked at the overall efficacy of this vaccine, it was 66% overall, and it was over 74% effective in transmission of COVID-19 in the United States. Now, what you need to remember is that this Janssen vaccine was actually done throughout the world. It wasn't like the other vaccinations that have been investigated. This one was also done in South Africa and Brazil, and so they had a really big variant problem at that time, and so the efficacy reflects that. Now, that being said, it has over a 90% efficacy in preventing the hospitalizations from this and 100% in preventing death. And so this is huge. And I think it's also kind of like some of our other vaccines, like flu vaccines that in the past that maybe haven't 100% prevented the transmission of flu, but made a huge impact on hospitalizations and death. So it's a very, very good vaccine, and it is out now. They feel that it will be this first group that has come out, the first batch of vaccines will be followed by some more batches in the next few weeks. And they have to build up their supply chain. So on March 8th, yesterday, we had expanded criteria for our eligibility for vaccines in the state of Georgia. And so included with our healthcare workers and nursing home residents and staff and public safety and seniors, we have now expanded to having added adults with intellectual and developmental disabilities, caregivers of children with complex medical conditions, and then folks that are working in pre-K, K through 12, decal, staff, and faculty. And so I'm going to go into that. We've gotten a lot of questions about this. So we wanted to make sure we shared with you all what the state has put out to clarify this. With intellectual disabilities, so they're characterized by significant limitations in both intellectual functioning and adaptive behavior. So this is things like social and practical skills every day. This disability should originate before the age of 22. A developmental disability is a physical or mental impairment that happens before the age of 22 and expected to last a lifetime. And it has to impact at least 3 activities of daily living. And those kind of things include self-care, receptive and expressive language, learning, mobility, self-direction, capacity for independent living, and economic self-sufficiency. So for parents with complex medical conditions that are at high risk for COVID complications, here is the list that the state has put out. And so it's malignancies that are actually under active treatment. If you have an immunocompromised state from like a solid organ transplant or bone marrow transplant or something where you're on immunosuppressant medication, that's something that would get included. We have critical congenital heart disease. We have asthma in the moderate to severe range, sickle cell disease, diabetes, obesity, where your child is in the 95th percentile compared to other children of the same age and gender, cystic fibrosis, significant neurologic injury or condition, and a dependence upon medical devices like BiPAP machines and tracheostomies. All right. And once again, we'll show you our vaccination site at Jim Miller. We're very, very grateful to the state for helping us with that. And just some continued pictures of their work out there. And I'll turn it over to Lisa to update you on some of the other activities that we have going on within the department.
Good morning, everyone. And thank you again to the county commissioners and all the staff with Cobb County. We certainly couldn't do this without you, and we see a light at the end of the tunnel. I think Dr. Memark let me do all the great news this morning for you, and I'm excited to share some progress that we've made. So over the last couple of months, we've been working with the large school systems in Cobb County and in Douglas County to prepare for whenever educators became eligible. So when that announcement was made a week or so ago, we were ready to go and have really hit the ground running. So I wanted to let you know this is kind of schedule that we have planned. Marietta City Schools is working with Pools Pharmacy, one of our spectacular partners in this vaccination effort. And later this week, they'll be providing their first dose to their eligible faculty and staff who are interested in getting vaccinated. and then they'll come back again in April for their second dose. Later this week, we're also working, Public Health is working with Douglas County School System to vaccinate almost 2,000 of their faculty and staff. And then on the 19th and 20th and 26th and 27th of March, Cobb and Douglas Public Health will be working with the Cobb County School District nurses to vaccinate about 10,000 Cobb County school staff at our Jim Miller Park drive-through. That's going to be a heavy lift, but we're very excited about being able to get all of our faculty and staff of the school system vaccinated. And then not to leave out any of our child care or pre-K or private K through 12 individuals, either Public Health or Metro Atlanta Ambulance or Pools Pharmacy or other providers in the community have linked with many of those agencies to help assure that in the next few weeks that their staff can get vaccinated. And at any time, any of the individuals in any of these agencies can always link into any provider and get an appointment wherever they choose to get vaccinated. So whether that is through Kroger or Publix or Public Health and our drive-through, they don't have to wait for these special events, but we wanted to make sure that these special events were available to them. Okay, next slide. We also have been rocking with our mobile vaccination efforts. Dr. Memark and Dr. Jackson had kicked that off earlier a month or two ago, and we have a staff that's scheduling and working with Cobb Senior Services, with some of our churches, and going out to those locations to vaccinate either through a drive-through setting or in an in-clinic, in-person setting. To make sure that we're reaching our most vulnerable residents. We've got a great system in place through the senior services and some of our staff to be able to find those residents, particularly our seniors, who don't have access to computers or who have some challenges with transportation, and be able to get them into some of these mobile events. So we're excited, and we'll continue to do that. That team is continuing to schedule at least a couple of events every week to do outreach. Next slide. And now I feel like this is like the breaking news of the week. We are so excited. I don't know about you, but this almost brought tears of joy to my eyes when this came out yesterday. So CDC just released new guidelines that said that folks who are fully vaccinated can visit with other fully vaccinated people indoors without wearing masks or physical distancing. So for example, I was in here on Saturday, and our clinical services director came in, and normally for the past year, anytime any of our staff have interacted, the minute we come in contact, we are making sure that we are fully masked up, and we've done all of our meetings physically distanced or virtually. But Catherine and I started meeting, and we paused for just a minute and realized that we could not have to wear a mask. And so we, for the first time in a year, conducted a meeting together where we weren't both masks up. So that was exciting. And then the other benefit is that you can have vaccinated people can visit with unvaccinated folks from a single household who are at low risk. So, for example, where this makes me so excited is imagine two fully vaccinated grandparents who can now visit with their daughter, their healthy daughter, and their healthy grandchildren, and not have to wear masks and not have to physically distance. I think that's a game changer at this time, and really gives light at the end of the tunnel. And then lastly, for folks who have been in contact with others who are positive for COVID and have had to either quarantine or make sure to go get tested within a few days, if you are fully vaccinated, you don't have to quarantine, and you don't have to follow up with testing as long as you remain asymptomatic. And that's an important exception, that if you become symptomatic, you do need to go follow up with the quarantine and the testing. And for the purposes of all of this, I think it's been mentioned before that a person is fully vaccinated 2 weeks after they get their second dose of a 2-dose series, so the Pfizer or Moderna, or 2 weeks after they've received a single-dose vaccine like the Johnson & Johnson. But I'm thrilled about this, and I think this really gives a lot of hope, particularly to our seniors who have been isolated over the past year. So great news from CDC yesterday.
Yeah, and if I could just chime in about that for a second, that although these vaccines are very effective, there is still a chance of breakthrough. So that between 5 and 34% could actually get COVID afterwards and don't have the protection. So I just want to make sure everybody understood that as well, that if you develop any symptoms after having exposure to COVID, even though you're vaccinated, that you should still be thinking about that potentially.
And next slide. Thank you, Dr. Memark. And so, as Dr. Memark was alluding to, there are still some precautions, right? It's not a complete pass to go back to how we were always doing things. Even though I am fully vaccinated, or people who are fully vaccinated, they need to continue to wear masks and physically distance when they're out in public. They need to make sure that if they're visiting unvaccinated folks who are at increased risk, so for example, if you are a healthcare worker who's fully vaccinated, but you have, if my in-laws are not fully vaccinated, as seniors, they would be more at risk. It wouldn't be wise for me to go into a setting with them without wearing my mask or maintaining that physical distance. We also want to continue to avoid large and medium-sized gatherings. Get tested, as Dr. Memark said. If any symptoms come up, you want to make sure to quarantine immediately and get tested, and then follow guidance for your individual employers. But I am excited about this. I think this is great news from the CDC. Next slide. I also want to make sure that while we are in this high spread phase that Dr. Memark mentioned to you all, that folks know that we're still putting a priority on testing. So Cobb and Douglas Public Health and our partners with CORE and Air National Guard are still offering about 8,500 test options each week, even though we transitioned and made Jim Miller Park a full vaccination site. Some new things have happened in the last few weeks. First of all, you can see some of the locations where we are consistently at least once a week at these different locations around the county. And then just a few weeks ago, we launched another testing site in partnership with Mako Labs at Jim Miller Park. So over under the pavilion area, not as part of our vaccination process in the equestrian center, but over on the other side of the building, Mako is doing testing. And so now we're up to probably 12,000 plus test appointments a week that are available to residents. We are certainly not at capacity right now with these test options, so you certainly should be able to get in either the day that you want to be tested or the next day. And the great news is that we're still seeing 24 to 36 hours actually of test results on turnaround time. The one difference, I'm sorry, Dr. Memark, the one difference with the Mako lab at Jim Miller Park is Mako is taking insurance cards. So don't be surprised about that. That's a little bit of a new twist on some of our sites. If you go to the ones that are noted above with CORE and our Air National Guard, we will not be collecting insurance. But at the Mako site at Jim Miller Park, we are collecting insurance, although there is no out-of-pocket payment from any resident. So if you are uninsured, if you have a high deductible or a copay required, none of that will be collected as a result of you going through the Mako lab. So I would encourage folks to go wherever that's most convenient for them and where they need to get tested. Next slide. So just kind of to wrap up, one, we're excited about more vaccines coming in with the Johnson & Johnson. We're seeing more come into us. It is still kind of like Christmas morning when we wait to see what comes in, because it's not quite everything we order all the time. We do want to encourage all residents to take whichever brand of vaccine you have access to. All of them have excellent effectiveness. All of them will help us get through this pandemic. And so please, whatever brand of vaccine you have access to, please take that. And then again, we can't have a presentations yet where we wouldn't end with saying, please, please make sure to still adhere to the 3 W's of wearing your mask, watching your distance, washing your hands, and limiting your gatherings of folks outside. Unless you are fully vaccinated, then we say, you can still gather with some small households, but not large gatherings. Dr. Memark, anything else you want to add?
Yeah. No, thank you.
And just again, to wrap up, commissioners, thank you so much for all the support they've provided throughout this pandemic. We are excited that our command trailer has just been delivered this week that you supported through the Community Development Block Grant funds. We also have our new mobile health van, and it's getting wrapped in final stages of that, so we'll be able to get that out into the community. So thank you very much for all the support that you and the staff have provided us ongoing. It's just been exceptional. Thank you.
Thank you. I appreciate you too providing this report to us every meeting. It's very helpful, particularly to know that we'll be able to expand the class of those getting vaccinated, especially to our teachers and those with disabilities. Do any commissioners have any questions this morning? I had one question. How many have we vaccinated here in Cobb thus far? I think I saw it on a slide, but I can't recall. Or how many vaccinations did we administer?
Here in Cobb is 143,463.
Okay, and that includes both first and second doses. Right, great.
Yes, ma'am.
Wonderful. Mm-hmm. Well, thank you two so much again. I can't wait to be fully vaccinated so I can comfortably take off my mask and see those unmasked as well. But thank you. We're getting there.